All right, guys, this is the very last lecture where I'm going to show you anatomy. Starting with the ventricles. So here's a CT. Again, all these are in your research helpful links in the course. This is your normal head CT link. We'll start out with this this week, and the anatomy we're going to go over today. There's certain anatomy that we're only going to see in certain planes, and that's because we're getting into like the nitty-gritty of these teeny little structures in the brain, and we just want to be able to have you recognize them for what they are, the major ones, where they are, and not go into too much crazy detail in all of the different planes, because that's just, we're not radiologists. So anyway, make sure that you take really good notes as far as what you need to know in what plane, because I will kind of swap up a little bit. Ventricles. Ventricles are easy to see on pretty much any plane, okay? So you have 4 ventricles, 1 and 2, which are your lateral ventricles, right and left, 3rd ventricle, 4th ventricle. On CT, not as easy to see as on an MRI, but you can see them. So here's your lateral ventricle right here, and then if we cross over, there's your other one, okay? And you have the frontal horn, and then this guy all the way kind of down here, not quite seen very well, is your temporal horn. And then it goes all the way back to this like point here. That's your occipital horn. Kind of goes out a little bit more there, okay? On both your right and left lateral ventricles, okay? It's kind of U-shaped with like a point on the back, I guess. So those are your ventricles. Your lateral ventricles. Your 3rd ventricle, which remember I said like on one slice it would be gone. This is like your 3rd ventricle in here with the thalamus making up the walls of it. So can't quite see it. It's not really easy to see. But what you can kind of see here is the foramen of Monroe, or the interventricular foramen, kind of emptying down into the 3rd ventricle, okay? And then after 3rd ventricle, we have down through, again, not easily seen on the CAT scan, but it's right here, the cerebral aqueduct, or the aqueduct of Sylvius, down into the 4th ventricle, the triangular shaped one. So there's your 4th ventricle. That travels down through the central canal, and then you have this posterior communication, the median aperture that goes down to the cisterna magna, which is back here. Okay, so this is CT in a sagittal. Let's look at the ventricles in an axial. Much easier to see, okay? Here's your frontal horns, here's your occipital horns, and then if we were to follow that down, not super easy to see your temporal. Can't really see. It's kind of in here. You can't really see on the CAT scan, but we will be able to see on the MRI. What I want to point out, you can kind of see the squiggly lines here inside the lateral ventricles. You can see here, okay, here, it's a little calcified. That's your choroid plexus, okay? So remember, the choroid plexus makes the CSF, all right? So that's right there. That up a little bit. So we have lateral ventricles. The lateral ventricles are separated by this septum, the septum pellucidum, right there. Just posterior and inferior is going to be your 3rd ventricle. It's just kind of right here, okay? And this is your foramen Monroe coming down there. And then we're going to travel posterior and inferior down through the aqueduct of Sylvius to the 4th ventricle right here, and then central canal traveling down. Okay, so there you have the ventricles. Coronal, if we travel all the way anteriorly, you're going to see your frontal horns of your lateral ventricles first, septum pellucidum right there. Okay, here's your 3rd ventricle in here, a little bit easier to see, I guess, on the coronal. Here's your occipital horns all the way posterior, temporal. Again, there's kind of a little bit of it down in here, not real well. Fourth ventricle right here. There's your fourth ventricle. Okay. Fourth ventricle, central canal. All right, so those are your ventricles. I did kind of touch on the cisterna magna right here. And then right here, your suprasellar cistern, the other cistern you need to do. On CT, super easy because you just look for sella turcica above suprasellar cistern right here. And the optic chiasma is in here, okay? You can kind of see, this is really crappy CT, but here's kind of the optic chiasma in here, where the optic nerves come up and then they cross over. Okay, so we've covered ventricles, we've covered cisterns. Also located within here, within the suprasellar cistern, is the circle of Willis, which we'll go over when we talk about the arterial system. All right, so I'm going to switch over to the normal MRI because this is going to be much easier to see the diencephalon and the limbic system, which we're going to move on to next. So, diencephalon, the thalamus, hypothalamus, pituitary, epithalamus. You're not going to be able to see epithalamus, done, end of story. Hypothalamus, so-so. Thalamus, pretty easy to see. Pituitary, pretty easy to see. And then in the limbic system, and pituitary gland, in the limbic system, we move on to the amygdala, olfactory tracts. You're not going to be able to see the olfactory tracts. The fornix, yes, for sure. Mammillary bodies, yes, for sure. And the pineal gland. So starting with the diencephalon. So let's look for thalamus. So in order to find thalamus, first thing we need to do is look for the third ventricle. Okay, easiest way to find the third ventricle is to look for the lateral ventricles, which are right here. Okay, there's your frontal horn coming back. There's your occipital horn right back there, and then we can follow this down to the temporal. There's your temporal horn. All right, so that's your lateral ventricles. So now we know that there's a connection right here between the lateral ventricles and the third ventricle. Okay, this is the third ventricle, but it's very hard to see because I go a couple slices and we're already coming out of it. What makes up the wall of the third ventricle? The thalamus. Okay, so that's the thalamus. Find the third ventricle, and then you'll find the thalamus gland right there. Okay, mass intermedia you cannot really see on this, so don't bother. You can call this the third ventricle. This would be the mass intermedia, this circle here, which is the connection between the right and left thalamus. The hypothalamus is below the thalamus. Below the thalamus, forming the floor of the third ventricle. So find the third ventricle. Your hypothalamus is going to be right down here. Okay, but right now we're starting to get into midbrain, the midbrain pons and medulla oblongata. So of the what's the word I'm looking for? Brainstem. Thank you, brainstem. So hypothalamus is going to be just below the thalamus, making up the inferior wall or the bottom of the third ventricle. Next we have the pituitary gland. All right, so pituitary gland is right here, okay, and it was a little bit calcified. So pituitary, then we have, remember that little stalk that goes up and will connect the hypothalamus or the floor of the third ventricle, kind of right here, to the pituitary gland, and that's this stalk right here. That's the infundibulum. Okay, so find pituitary, suprasellar cistern right here, this little stalk guy that goes up, connecting the hypothalamus right here with the pituitary is the infundibulum. And then this guy right here is the optic chiasma. So you could follow this on either side. it's coming from, you can see right here, coming from the eye. Okay, there's your eye, eyeball. Follow this guy back. Right here, over, 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 optic chiasma. Okay, it's now crossing over just above the pituitary infundibulum, connecting back to the hypothalamus, thalamus gland. Okay, so epithalamus, don't worry about. Epithalamus, just know what it does. It is the most posterior portion. It contains the pineal gland and the, right here, and the posterior commissure, which is right here, this guy right here. So the epithalamus is back in here. If you want to try to find it, look for the splenium of the corpus callosum and look just below it, and there it is. You'll find it. This is this guy right here, and then pineal gland right here. Which on this guy is not calcified, on other people it is. What else do we need to do? Look at limbic system. So moving on to, actually we looked at all of that anatomy in the sagittal view. Let's look at all that anatomy on coronal. So in sagittal, you have to be able to locate the pituitary gland right here, the pineal gland below the splenium right here, this circular gland below the splenium, and the epithalamus is in there, but you don't need to know that. The hypothalamus, this right here, making up the floor of the third ventricle, the thalamus right here, mass intermedia right there, and then from the pituitary, the little stalk coming up, the infundibulum, and optic chiasma. Okay, so those are all of the things that you have to know in the sagittal. So now we'll switch over to coronal and look for the same thing. So let's go anterior. Oh, wrong way. Anterior. And some of these things are much easier to see in the anterior, in the coronal plane. So here's our eyes, eyeballs, right here. Boom, boom. So there's going to be right here, this is your optic nerve. Follow that guy back, okay? Follow him back here. It's kind of going to change color as it becomes different tissue, nerve tissue. Okay, so follow that guy back. Follow, 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 and look at, now they connect. That's the optic chiasma. That's where the right and left cross over. Optic chiasma, okay? Right, left optic nerves coming in, connecting, optic chiasma. Just below that, pituitary. This is pituitary gland. The stalk that kind of travels, it's not connecting to the optic chiasma. It looks like it is. It's actually traveling posterior to that, back to the hypothalamus, is the infundibulum right there. Okay, so pituitary, infundibulum, not connected to the optic chiasma, although it looks like it, and that's your optic chiasma. Okay, thalamus lies on either side. This is your thalamus gland right here, on either side of the third ventricle. This is lateral ventricles. This little guy's third ventricle here. So on either side of that is the thalamus. Below that is the hypothalamus. So you actually can see how the infundibulum comes up and connects to the hypothalamus as the optic nerve has crossed over and now goes and travels back to Broca's area. Okay, so there's that. As we continue back, we want to look for the splenium, okay, right here of the corpus callosum, and then just inferior to that is going to be the pineal gland, which is right here. Okay, there's your pineal gland. And then this guy is not calcified. So that's everything you need to know for the diencephalon. You only need to know them in coronal and sagittal planes, okay? Everything I just showed you. So now we're moving on to the limbic system, which is really kind of tied into all of this. The limbic system, let's switch back over to the sagittal. So here's your pituitary. We already talked about pineal gland right there. Hippocampus, don't worry about that. Although, if we switch over to look at the cingulate gyrus, right, where am I here? Sorry, got to get my bearings. Cingulate gyrus, right here. Okay. This fold right in here. Okay. If you find that, the cingulate gyrus, what I think is the easiest thing to do is look, I'm trying to find your page number so I can show you. Page 117. If you switch to page 117, you have the cingulate, I'm sorry, not cingulate gyrus, the parahippocampal gyrus right here. This is cingulate gyrus up here. I apologize if I've confused you. This is the cingulate gyrus up here, the fold just above the corpus callosum, and then inferiorly, the fold below is the parahippocampal gyrus right here. So if you look for that and you look on page 117 in your text, you can now start to pick out the portions of the limbic system. And remember, I said in the slide when we did the lecture that the anatomy on a 2D image is not the same as the anatomy in a 3D cross-sectional scan of an actual patient. So when we look at this image here in the book, page 117, everything looks really pretty because it looks like it's all on the same plane. But in the body, I will tell you it's not in the same plane. So I'm going to show you the easiest way to find this, to find the parts of the limbic system that you need to see, is find the parahippocampal gyrus right here. Okay. Once you find that, you want to go travel laterally a little bit and look at this almond-shaped guy in here. Okay, almond-shaped guy in here. All right, this right here is the hippocampus, and then the almond-shaped portion anterior to that is the amygdala. Okay, so just superior to the parahippocampal gyrus, you have the hippocampus and the amygdala. Okay, amygdala is this almond-shaped guy right here. All right. So there's that. The next thing you have to know is the mammillary body right here. So I'm now going central. I was lateral before when I was at the parahippocampal gyrus, okay, because I'm in the cerebrum. I'm now traveling to the middle of the brain, the very central portion, and I'm looking for this kind of little, I don't know, stalk coming off of the superior portion of the brainstem. So this little stalk right here, all right, that's your mammillary body. And there's two of them on either side, boom and boom, okay? Mammillary bodies. Next thing you need to know, fornix. Fornix is this little arm that comes off anterior and inferior to the, corpus callosum, okay? So the middle, this arm right here, that's your fornix of the limbic system, okay? And mammillary bodies, amygdala, that's it. So that's what you need to know, and you only need to know these in the sagittal plane, because once we start switching to other planes, it's confusing enough in a sagittal. And it's laid out right for you, and it's almost exact as long as you remember that it's not in the scan that you're going to be looking at on the computer is not in a 2D image, it's 3D. So if you can see the pituitary gland, the mammillary bodies, the thalamus, you have to go lateral to that either way in order to see the amygdala, okay, right here. This almond-shaped structure of the limbic system, just superior to the parahippocampal gyrus, okay? So that's the limbic system and the only thing you need to know in the limbic system. So now let's move to the brainstem. Brainstem, 3 parts, midbrain pons, medulla oblongata. All right, so let's get to the middle brain. Where are we? Here we go, right here. All right, 3 parts. The most superior part, the midbrain, right here. And if you go to a slice where the aqueduct of Sylvius is coming down here to the 4th ventricle, there's your 4th ventricle. If you see that aqueduct, the area anterior is going to be the cerebral peduncle, or peduncles, and the area posterior is the tectum. Okay, those are the 2 segments of the midbrain. And remember the 3 different parts that make up the brainstem, midbrain, pons, and medulla oblongata down here, are all connected and all have in common this strip back here called the tegmentum. Okay, the tegmentum is what connects the brainstem and makes it one whole part, okay, with 3 separate segments: midbrain, pons, medulla oblongata. Okay, the midbrain has 2 segments: the peduncle, cerebral peduncles, and the tectum, posterior to the aqueduct of Sylvius. Okay, if you are on a sagittal slice and you see the 4th ventricle, look just anterior to that. You're going to see this circular, enlarged area coming off the anterior portion of the brainstem. That's your pons. And then just inferior to that, this guy right here is your medulla oblongata. Okay, points to remember here: the tegmentum connects all 3. Aqueduct of Sylvius, 4th ventricle, central canal, and then you have down going into your cisterna magna, the median aperture is in here. Okay, right here, connecting over to the cisterna magna back here. All right, so that's that. Am I missing anything? No, I don't think so. These I will have you know in a sagittal, and then let's go over and look in an axial. It's going to be a little bit harder in axial, but I'll walk you through it. All right, so in brainstem, first thing I want you to do is look for Mickey Mouse. You see Mickey Mouse right here, okay? You want to go 1 slice above where Mickey Mouse is, or 1 slice below, whichever. It's going to help you to see where you are and get your bearings, okay? So first thing, look for Mickey Mouse. Just anterior to Mickey Mouse, suprasellar cistern. Look at the optic nerves coming down. Suprasellar cistern, okay? So we know in here is the pituitary gland, boom, right there. What's this guy? Dorsum sella, okay? So pituitary gland, we know there's a stalk, there's a little stalk coming up superiorly that's going to connect to the hypothalamus, all right? We have these Mickey Mouse ears coming up. I'm trying to find your book, what page it is on your book to help you. Where is it? On page 122. 122 shows this area. Look at this right here. The bottom of page 122, this is exactly what this is pointing to, okay? It's that drawn picture, figure 3.63, is this, all right? Cerebral aqueduct right there. So if I keep going down, what am I going to hit? 4th ventricle, okay? So there's your aqueduct of Sylvius right there, all right? What is these 2 like ear-like structures of my Mickey Mouse, my eyes? These are the peduncles, the cerebral peduncles, okay? Right there. So when you get to this level, you know that the cerebral peduncles are here and here, cerebral aqueduct or aqueduct of Sylvius. The area just posterior to that, here, is your tectum, okay, of your midbrain. So I'm higher up right now. I'm in my peduncles of the midbrain. As I keep traveling down, okay, I now have got, going up, wrong way. Right, as I keep going down, I now have this bulb here. That's your pons, okay? And you can kind of see how it's like a little bit separated. This is your tegmentum that connects your midbrain to your pons. Tegmentum's back here. And then as I go a couple more slices down, medulla oblongata right here. Okay? So we'll do that again. Mickey Mouse ears. This is the same, this picture and this picture are almost exactly the same as the figure 3.63 on page 122 in your book. Tectum, cerebral peduncle, cerebral peduncle, cerebral peduncle, cerebral peduncle, cerebral aqueduct or aqueduct of Sylvius. Keep going down, peduncle, peduncle. I now have become a bulb. This is tegmentum. I now am at pons, right here. Keep going down, medulla oblongata. Okay, so that is your brainstem in axial and sagittal views only. Okay, you don't need to know them in coronal, although I can show you really quickly. It's not that difficult. Here is your peduncles up here, and if we go a little anterior to that, you have pons right here, and then medulla oblongata. And then these right here are the olives. And remember, we talked about the how they cross over, the nerves cross over. This is where the tracks cross over in the olives of the medulla oblongata. So right and left then of the extremities crosses over to the right and left of the brain. All right, we're moving on to the arterial system. There's a lot as far as the arterial system goes. I'm going to switch over to the normal circle, the CTA, circle of Willis. There's a lot of anatomy that goes into this, and you can look text on page 141, which shows a very simplified version of all you need to know. Basically, you need to know the circle of Willis and the main vessels that feed the circle of Willis. So the main vessels that feed the circle of Willis are anteriorly the two internal carotids, right and left, and then posteriorly the two vertebrals, right and left. Okay, the two vertebral arteries, let's go down. Here's internal carotids, right and left, vertebrals, right and left, and as I go up, the carotids are going to travel through the carotid canal. Okay, you guys have learned that, carotid canal, and my vertebrals are going to combine to form the basilar artery. Okay, so basilar artery comes together. From the vertebrals come together to form the basilar arteries. Here's your carotids, right and left internal carotids. Now the carotids are going to start taking like these crazy loops. Okay, if you look in your text on page 135, you can see how if you follow the carotid up, this is a sagittal view. If you follow the carotid up, it kind of dips down and up and down and up. So you can imagine if we're looking at this picture from a slice, an axial slice, you can see how the carotid is going to come in and out, and it kind of looks really funny. It's not different vessels. This is still the carotid. It's just doing these like squeaky turns here, these S turns up and down. So we have our vertebral, our internal carotids, our vertebral, or I'm sorry, our basilar, which is our combined vertebral, is going to split. Okay, it's going to bifurcate and form the left and right posterior cerebral arteries. Left and right posterior cerebrals. Okay, that makes up the posterior arch or circle of the circle of Willis. Okay, right there. Basilar, right posterior cerebral, left posterior cerebral. These little teeny guys coming off anterior, right here, those are your left and right posterior communicating arteries. Remember, there are two of them. Next slice up, here's your middle cerebral, your right middle cerebral and left middle cerebral coming in, which will combine with the internal carotids, okay, to form the anterior arms or arches of the circle of Willis. And these are going to form the anterior right and left cerebral arteries right here. Right and left anterior cerebral arteries. And then this little guy right here that connects the right and left anterior cerebral arteries is your anterior communicating artery. Okay, so this is in the the axial C+. If you look at the axial CTA MIP, it's going to look so much prettier. Look at how much prettier that looks. Okay, that's multiple image projections. You have your tubertebrals coming in, combining with your basilar. Basilar bifurcates to right and left posterior cerebral artery, right and left posterior communicating artery, middle cerebral, right and left, coming in to combine with your right and left cerebral arteries, and then this little guy here is your anterior communicating artery. All right? That's all you need to know as far as the arterial system in the brain goes, the circle of Willis and the circle of Willis only. Last but not least, I'm going to switch over to the venous system. The venous system is the drainage for all of the deoxygenated blood from the brain out to the rest of the body. So the three main parts, the superficial cortical veins, deep veins, and then the dural sinuses, which is what we're mostly going to concentrate on, eventually come down and empty into the internal jugular veins down here. Okay, so all this stuff is going to come down and empty into the internal jugulars. So first thing we need to do is go over the superior sagittal sinus, is this big guy here. Okay, sits in the falx cerebri, between the falx cerebri and the calvarium or the skull. So your superior sagittal sinus. Superior sagittal sinus comes down. Okay, back here, I have this guy right here. This is your straight sinus. There's your straight sinus. It's pretty good size. This little segment here, which is the draining of all these internal veins, the internal petrosal, all of these other little veins are going to come down, and they are going to internal cerebral veins, that's what I was looking for, and form the great vein of Galen, this short little segment right here just before it empties into the straight sinus. Okay, so there's that. Then you have the transverse sinuses that actually come out towards you. So in a sagittal view, which is the only view you need to know the sinuses in, it's going to come straight at you. So it's going to look like a circle traveling transversely along the skull. Okay, and then it's going to kind of take a turn as we're out here. It's sitting down here. It's going to take a turn trying to find it. It's not really easy. What you can't see because the bone is in the way. Down in here is where it's all going to connect out here in this little guy here and kind of make that S turn. As this guy makes the S turn, this portion of the transverse, that's your sigmoid sinus as it dumps down into your internal jugular right there. Okay? And then inside in here, cavernous sinus right here. Okay? That's all you need to know as far as that goes. Make sure that you took really good notes as far as what anatomy you need to know in what plane as far as the exam is concerned, because you're not going to have to know all of them in all planes. Go back and listen to this again so that you know exactly what you need to know in what plane, so you're not over studying.